Today I'm going to show you how I perform a PRP injections of the spine. This patient has a tear at his L5-S1 disc, and we're going to do a caudal epidural injection that's going to cover that disc with PRP to help it heal. And he also has some instability at the L5-S1 vertebrae levels. So I'm going to do PRP around those ligaments to give it some stability so it doesn't move. So I have already marked the area with the ultrasound. What I'm going to do next is I'm going to clean the area with a surgical cleanser. This is the same kind of cleanser that is used in surgery. And what it is going to give us pretty much a sterile field. So after I clean it, I'm going to go ahead and anesthetize it with a anesthetic, and I'm going to be using lidocaine along with ropivacaine. And these anesthetics are both short-acting and long-acting. The lidocaine will pretty quickly give anesthesia to the patient, while the ropivacaine will last a little bit longer. So after the procedure, the patient won't feel as much pain as well. So first I'm going to numb up some of the spots that I'm going to inject. Here we go. Floyd, here we go, a little poke. All I'm doing is anesthetizing the areas that I'm going to be injecting, and this makes the procedure a little bit less uncomfortable. So as I mentioned earlier, we're going to be treating the disc that has a tear in it with a caudal epidural. He is already numb and sterilized, so what I'm going to do is I'm going to take some of the PRP and inject it through his tailbone, and that's going to bring the medication all the way to that L5-S1 disc. And that's going to start the whole healing process. Right here, and my needle is going to come right in there, and that's the sacral ligament. Once I cross it and I inject medication in there, it's going to go straight up to the spine. All right, I'm in that space. Shannon, if you can give me a Doppler, please. Now we're going to see the medication flow in there. Okay, bring it up a little bit. Are you doing okay, Floyd? Mm-hmm. How's the pressure?
Nothing right now.
Okay, good. You can turn it off. So we know that the PRP is going inside, and as I push the fluid in, it's going to travel up towards the spine. How's the pressure?
Variable.
Okay. Please let me know if it becomes a little bit more than bearable. So with the caudal epidural, the idea is to get enough fluid that's going to flow up to the spine and to the discs and nerves that we're trying to address. At this particular case, I'm trying to get the PRP around the L5-S1 disc and the L5-S1 nerves as well on the left side. So as the medication or the PRP travels up, it's going to cover the nerves and the disc and stimulate the whole healing response. How are you doing? How's the pressure?
Pressure's okay.
Very good.
I can actually feel it in my toes.
Yeah, the patient will feel some of the pressure into their legs as the PRP travels up the spine. So now that I am done with the caudal epidural and the discs and the nerves are covered, my next goal is to inject the ligaments of the L4, L5, and S1 vertebrae. The idea is to stabilize them to prevent them from moving. This patient has some instability at L5-S1, and the whole idea is to inject around those areas, all the ligaments, the muscles, to stabilize it as much as possible. Don't take it off yet. Hold it. So this PRP, as you can see, it's nice and amber. It's not red, so there's no red blood cells. We find that PRP that's amber without the red blood cells tends to be less inflammatory and less painful. So that's the one we produce. There's a lot of different ways to produce PRP. We have our ways, and I believe we produce a very high quality PRP. So I have the L5 vertebrae identified, and what I'm going to do is just bring the needle up to the facet joint, and I'm going to inject some of the ligaments. Okay, I'm going to move on to the second level. Now we're going to go to L4. Same concept. So we can see the vertebrae on the ultrasound right now. We can see the vertebrae and the facet joints. So I'm going to use that guidance to guide my needle to get to the facet joint. Floyd, you doing okay?
Yep. No problem.
All right, so here we go. The needle is on the facet joint. I'm going to go ahead and inject. Now it's very important also to stabilize the sacroiliac joints, as these are kind of like the base of the spine. Shannon, can you decrease the depth for me? And increase the gain. So we're going to inject around the sacroiliac ligaments. Increase depth 1. There we go, perfect. A little poke. And we're going to go to the sacroiliac joint and inject around the ligaments. Again, the whole idea of this is to stabilize the area. So we are done with the left side. Now I'm going to work on his right side, L4, L5 facets. And what we're going to do is make sure, again, stabilize the ligaments on both sides. So it is very important when you're treating the spine to treat both sides to really get nice stability. This way the spine is going to feel more stable, and it's not going to move as much, and those discs are not going to degenerate as much. As in this case right here, that L5 S1 disc really needs a little bit of help. So we're going to provide that by getting the ligaments nice and thick and strong. So now that the patient has PRP around his discs inside the epidural space and PRP around the ligaments of the L4, L5, S1 vertebrae, next phase will be healing. The whole idea is for the next couple weeks, his body is going to create a response where stem cells, fibroblasts, and other cells come in and start the whole healing process. And the patient will feel a little sore for a couple days, maybe up to a week. But after that, the patient will start feeling better and better, and the segments are going to start feeling more stable, and the spine will heal. So that is his next phase, and we'll see how he does.